This is TKontz for physical assessment video number 1 for NURS 329. I would come in, provide privacy, wash my hands, introduce myself. I'm Tanae, I'll be your nurse, and I'm going to do your assessment today and take vital signs. So, how are you doing today?
Good.
Okay, and can you tell me your name, please? Okay, and do you know the date today?
May 24th.
Okay, and where you are?
Home.
And why you're here?
For an assessment.
Okay, thank you. Patient is ANO times 4. Attention and speech are intact. So I'm going to go ahead and start your assessment. I'm going to touch your head, checking for any abnormalities. Okay, head is normocephalic. Hair is equally distributed. I'm going to palpate your frontal sinuses and your maxillary sinuses. No swelling noted. Trachea is midline. And no thrills noted over the carotid. So I'm going to have you take a drink of this water. I'm going to touch your thyroid. Okay. Thyroid is equal bilaterally. Next, I'm going to assess spinal accessory nerve, which is cranial nerve number 11. So I'm going to have you put your head forward and go back. Okay, and then side to side. Any pain with that? Okay, neck range of motion is equal. And push your head against my hand. Okay, and shrug your shoulders. Thank you. Movement is equal bilaterally, and CN11 is intact. Next, I will have you clench your teeth and move your jaw side to side. Okay, and that is motor trigeminal cranial nerve number 5, which is intact. Now I'm going to take this cotton ball and I'm going to check sensory trigeminal. Close your eyes for me. Okay, can you feel that?
Yeah.
Okay. And that. So ophthalmic, maxillary, and mandibular branches of the trigeminal are intact. Excuse me. Okay, next I'm going to check cranial nerve number 7, your facial cranial nerve. Wrinkle your forehead and squint your eyes and puff out your cheeks and smile. Good. All right, movement is symmetrical bilaterally. Cranial nerve number 7 is intact. I'm going to palpate for your lymphatics and make sure that they're not swollen. So preauricular, postauricular, occipital, tonsillar, submental, submandibular, anterior cervical, and posterior cervical, supraclavicular, and infraclavicular. Lymphatics are equal bilaterally and no swelling noted. Okay. So next I'm going to assess the ears. Helix, antihelix, tragus, antitragus, and lobule are intact, and I would assess those bilaterally. Next I'm going to do the whisper test, which I stand an arm's length away. Ask the patient to repeat 3 numbers or letters that I whisper. 6x9.
6x9.
Okay. Good. Okay. Hearing is intact. Next I'm going to have you do the Romberg test. So I'll have you stand up and close your eyes and bend your knee a little bit with your toes off the ground. Lovely. Go ahead and sit back down.
Oh, sorry.
So, negative Romberg test. Your balance is intact. Next, I'm going to look in your ear. So, I'm going to pull the ear up and out. And look in. Okay. See the malleus, Inca, and umbo. And the light hits the tympanic membrane at 2 o'clock. Next, I'm going to check the optic nerve. So I have my pen light. I'm going to have you close your eyes and open. Okay, looks good. Pupils are equal, round, and reactive to light, and I would test those bilaterally. Next, I will check for accommodation. So can you focus on my finger and then focus on the wall? Okay, accommodation is present. The eyes dilate as they focus on the wall. Next, I will check for cranial nerves 3, 4, and 6. So look at my finger. Okay. Okay, looks good. Cranial nerves 3, 4, and 6 are intact. Eyes move smoothly, and they move smoothly with movement. Sorry. Okay, next I will check for strabismus. So I'm going to have you cover your eye, and you can uncover your eye and focus on my finger. Okay, no strabismus noted. Excuse me. Next, I will check olfactory. So close your eyes for me. And I'm going to hold this scent under your nose. And can you tell me what it is?
Lavender.
Okay, good. All right. Cranial nerve number 1, olfactory, is intact. Okay. I'm going to look in your nose.
Oh boy.
Okay, and I would assess this bilaterally. Inferior and medial turbinate are intact, not swollen, not obstructive. Okay. Next, I'm going to check your cranial nerve number 9 and 10, glossopharyngeal and vagus. So I will have you stick your tongue out. Actually, I need a tongue depressor. Sorry. I got it. I don't got it. There it is. Okay, can you open your mouth for me and say, I would check the gag reflex, but not for the purposes of this video, and say ah.
Ah.
Okay, palate and uvula rise equally. Tonsils are 1+. Okay, mucosa is pink and moist. And last but not least, we have cranial nerve number 12, hypoglossal. So can you stick out your tongue for me? No fissures or cracks noted on the tongue. Move it up and down and side to side. Good. Okay, cranial nerve number 12 is intact. And it's symmetrical. You look good.
Thank you.
Okay, that's it for my first assessment video.